Hello, everyone, and welcome to our second installment of the HealthLinks 2025 webinar series. Thank you for joining us today. We're watching all of you as participants join into our webinar. For those of you that have been here before and know the drill, it's coming up in just a moment, but if you want to let us know in the chat where you're joining us from, we love to see all of the locations that are joining us on the webinar series. My name is David Shapiro. I use he, him pronouns. I am a white male in my late 40s, and I have dark brown curly hair, a brown beard, and I'm wearing large gray glasses. Today's conversation is on heat at work, a total worker health approach to heat stress and mitigating heat stress as a hazard, occupational hazard in the workplace. And we're really grateful to see so many of you joining us again, returning. For those of you that are new, welcome to the HealthLinks webinar series. Just a few housekeeping items. All of our participants today are on mute, and we ask you to use the chat function to tell us where you're from, like so many of you are doing right now. Also, if you have any technical assistance questions on how to interact with Zoom, please use the chat for that. However, if you have questions for me or for any of the speakers today, we ask you to use the Q&A function on your Zoom toolbar. And that's because your friends and colleagues that are here on the webinar with you may have the same question, and you can vote using thumbs up if you have the same question as someone else, and that helps us in our moderated Q&A section to know what questions you all have for people who are presenting today. Closed captioning isn't available, and please use your Zoom toolbar and other supports for closed captioning. And we know so many of you are here and looking to claim continuing education credits. Please stick with us through the end of the webinar. A survey should automatically generate when we're done. That helps us provide those continuing education credits. And towards the end of the hour today, we will also be adding a link to that survey. But the way to claim your continuing education credits is to fill out that survey and finish the survey to claim them. It's a short survey. And finally, the webinar is being recorded today. For all of you that have registered and are participating, you'll receive both the presentation from our keynote speaker and the recording of today's webinar to share with your friends and colleagues as well. A little bit about us. The HealthLinks program is a public health outreach program located at the Centers for Health, Work, and Environment. We're at the Colorado School of Public Health on the Anschutz Medical Campus in Aurora, Colorado. And really, it's our goal to advance worker health, safety, and well-being. And so it's important that we continue to have conversations around occupational stresses and hazards like heat stress. We do work with companies on a healthy workplace assessment that employers complete in order to get designated as a healthy and safe workplace. And so if you want to find out any more information about bringing the HealthLinks program to your place of work, we operate in at least 13 or 14 states around the US. We've worked with a few countries internationally as well, and we'd be happy to talk to you about utilizing HealthLinks as a tool for your health and safety program. And we are one of 10 centers of excellence for total worker health funded by the National Institute of Occupational Safety and Health, or NIOSH, at the CDC. So excited to have you all here today and to continue these conversations about workplace health and safety. We always start these conversations with a land acknowledgement from the University of Colorado. I'll read that now. As we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of indigenous peoples recognizes the original stewards of these lands and their legacies. With this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profound negative impact on Native nations. We respect the many diverse Indigenous people still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native peoples. I want to mention that the views expressed today by myself and our other speakers are solely the views of us as individuals. They are not reflective of our program, HealthLinks, of the Centers for Health, Work, and Environment, or more broadly of the NIOSH, the National Institute of Occupational Safety and Health at the CDC, Department of Health and Human Services. We encourage you to engage with this webinar to the extent that feels most comfortable for you. And just as a reminder, a summary of the webinar, the presentation, and the recording will be sent to you at some point in the next 48 to 72 hours. So an agenda for today, we're going to have a keynote presentation. I'll introduce our keynote speaker soon. We'll have a brief panel discussion with a few individuals that are putting heat stress mitigation efforts into practice in their workplace, so you can find some more practical examples of some of how this is being carried out. And then we'll close with a question and answer session. So be thinking about the questions you have of our presenters and start putting them in Q&A when you are able to do that based on what you're hearing from our speakers. Our objectives for today are so that you better understand heat stress's health risks and the safety implications in a variety of different work environments, that you learn more about how to implement practical measures for preventing and managing heat-related illness in the workplace, and that you can explore or understand more about a total worker health approach to developing comprehensive heat stress prevention and management programs. With that, I'm going to introduce our keynote speaker, Dr. Maggie Morrissey Basler. Maggie is an assistant professor of health sciences at Providence College and the senior advisor of occupational heat safety at the Corey Stringer Institute, which is housed at the University of Connecticut. She has over 35 peer-reviewed publications on heat stress, worker health, and hydration. And in 2020, Dr. Morrissey Basler led a 51 expert roundtable on strategies and resources to protect workers' health, safety, and productivity, which resulted in a consensus document used to inform OSHA's heat stress regulations. She also serves as the chair of the Thermal Stress Working Group at the American Industrial Hygienists Association and a subcommittee member of the recently published ANSI ASSP A10.50 Heat Stress Construction Voluntary Standard. Dr. Morrissey Basler has been invited to speak about heat safety at many safety events and conferences around the country and around the globe. And she's worked with numerous organizations like even UPS and Delta Airlines to improve their heat stress management plan. Maggie has dedicated her career to providing evidence-based guidelines to protect underserved working populations from heat stress through research, education, and advocacy initiatives. Maggie, it's really an honor and a privilege to have you presenting and speaking with us here today. I'll turn it over to you.
Great. Thank you so much, David. I'm going to quickly share my screen. Hello, everyone. I'm thrilled to be speaking with you all today. Let me just make sure it's in presentation mode. Here we go. And what I'm going to touch on today as a introduction is extreme heat in the workforce and how can we stay safe, healthy, and productive. And so there's two buckets that I'm going to talk about today. And one is really what's the problem? How does heat negatively impact workers? And on the other side, we will then understand what the problem is, but what are some solutions? What can be done to have workers safer, healthier, and more productive? And a lot of this, I'm going to focus on topics that I find to be really misunderstood throughout the workforce, as well as some strategies that are a little bit more low-hanging fruit to implement. And so there are a series of negative health impacts associated with heat. And so when someone is working in the heat, then heat exposure is a combination of physical exertion, environmental heat load, as well as the insulating properties of personal protective gear. And so you see on the left that exposure to heat has a series of physiological effects. And these effects are actually not negative at this point. This is how your body tries to maintain its normal function. And so you have increases in heart rate, sweating, skin temperature. You can have dehydration without adequate fluid intake. But it's really the repeated exposure and continuous work that occurs in excessive heat exposure without rest breaks, with strenuous physical activity, inadequate hydration, that leads to these severe health consequences such as fatigue, cognitive impairment, hyperthermia, increased cardiac events, acute kidney injury, and heat-related illnesses such as heat stroke. And so these are all compromising health and safety as well as causing productivity loss. And again, it's this repeated frequent exposures. And so when we think about data associated with heat-related illnesses, especially if we look at what's reported from in the United States, OSHA, it seems like the numbers are very low. So people are puzzled how heat is a significant health hazard, but really this number is extremely underreported. So to emphasize this fact, there was a study done in California where they looked at worker compensation claims to see if there was any additional heat-related injuries that may have been unaccounted for. And interestingly, they found that 20,000 heat-related workplace injuries were not accounted for in California alone. And if you extrapolate that to the entire US, it's about 170,000. And so the reason being is that, again, heat causes so many more things than heat-related illnesses like cognitive dysfunction, cardiac events, and kidney injury and disease. And especially in the United States, we're not getting good reporting on this data because OSHA requires the recording of only the proximal cause of injury and death, not what is causing that. Also, sometimes heat-related illnesses, the treatment for that is classified as first aid. And unfortunately, a lot of undocumented workers, their injuries or fatalities are not reported. Heat stress can also have a significant impact on productivity. And so productivity loss can occur from non-labor associated things, but we're going to focus on that today. Whereas you could have both presenteeism and absenteeism, where presenteeism is you're having a reduction in the work that's actually performed during the work shift, whereas absenteeism is you're having more people that aren't able to come to work because of the negative effects of heat. And so labor productivity can be a lost work time, reductions in physical work output, the quality of work is reduced, as well as physical and cognitive performance impairments. And so this has significant economic costs because of lost salaries and wages due to fatigue and injury, cost of the claims, and then the healthcare costs associated with treatment and rehabilitation. And to put this in perspective, it's a little terrifying, but related to the economic burden in the United States is on average, the United States could lose about $100 billion annually from heat-related lost productivity. And if we think about that, that's actually the Department of Homeland Security and the Department of Housing and Urban Development, their annual budgets combined. And this is back in 2021 when this data was reported, and it's going to progressively get worse. So overall, heat exposure has a lot of effects, negative effects on health, safety, and productivity. So we're having these reductions in physical work capacity, lost work time, and more days away from work. But we also have these acute health effects like heat illness, cardiac events, kidney injury, and we can have chronic effects as well. So that repeated exposure over time can lead to kidney disease, chronic fatigue, and other heat-related illnesses. So what are some solutions? What can we do to mitigate these significant effects? Back in 2021, we recognized that there wasn't a document that was you really brought together a group of experts from all different areas related to occupational health, physiology, and more to really determine what evidence-based strategies should be implemented in the workplace. And so we published this paper in GeoHealth, which was a consensus document that provided 40 recommendations that were systematically scored by all authors, and there was quite a few, based on its evidence, its feasibility. So is it actually able to be implemented? And then its clarity. And so we came up with these 8 topics that where each of these recommendations stem from. So we had heat hygiene, which is basically practices that promote better heat tolerance. So education is a key component of that. We have hydration, heat acclimatization, environmental and physiological monitoring. Although we certainly have a long way to go related to physiological monitoring, it is something as technology advances to keep on our mind. Body cooling, that both being active and shade. We have personal protective equipment and clothing, and then emergency procedures. And so all of these components should be in a written heat stress management plan that is available to everyone. So everyone's able to access what's going to be done on their work site to protect them. And so for today's keynote, I'm just going to focus on a few of these strategies. And again, I want to focus on education because it's pretty low hanging fruit. But I work with a lot of companies, and oftentimes they have some sort of educational component, but it's very lacking in detail and specifically information that workers need to know. And then I'm going to talk about heat acclimatization and emergency procedures, which these two, there's a lot of misconceptions surrounding. So education, there's key components that should be included in education, and this should be during not only onboarding of new employees, but also annually as we get more research to develop evidence-based practices. And so it should include risk factors of heat-related illnesses and injuries, the effects of heat on health, safety, productivity, what are the prevention strategies, first aid, and emergency response procedures for heat illness. So there are a series of risk factors that are associated with heat-related illness, and I'm not going to go through all of them, but this is a list of some of the common ones. And so we have ones that may be a little bit more obvious, like the environmental heat load, physical exertion, but we have others such as use of prescribed drugs or medication, poor diet, individual characteristics such as cardiovascular disease, diabetes, hypertension, obesity, and other factors. So heat acclimatization. I love talking about heat acclimatization because it is by far the least implemented strategy, but arguably one of the most important because the heat-related illnesses and injuries in the workplace typically happen within the first 3 days of a new worker starting. And so it's really important to gradually expose workers to their work environment in the heat. And so what a heat acclimatization protocol is it's this repeated bouts of physical activity in the heat that are going to induce these physical or physiological adaptations that are going to allow them to perform better, be safer in the heat. And it's not the same as self-paced work. So a lot of times when I talk to people, they say, yeah, well, we just tell our workers to take it slower when they first start. But a heat acclimatization protocol is a protocol that is supervised by the employer. And so this pertains to not only new workers, but workers who are returning from a prolonged absence. And so NIOSH has recommendations that are associated with a heat acclimatization protocol. This one on the screen is coming from the GeoHealth paper that I just discussed, the consensus document that recommends having the initial heat acclimatization protocol that where you're increasing about 10 to 20% of work every day. This again is to slowly and gradually expose the person to a hot environment. And then we have a reacclimatization protocol where workers who are returning from a prolonged absence, meaning they've been gone for 2 weeks, need to be reacclimatized because they've lost those adaptations they had originally had obtained. And so heat acclimatization is going to look very different depending on the actual work environment, right? We know industries are very, very different. Someone who's working in a manufacturing plant who may be doing the same activity every day is going to have or is going to climatize differently than someone who is going to perform unaccustomed work potentially daily. So just some considerations. The last portion I want to talk about, which I think often gets forgotten, is sort of this second level of prevention. So we have prevention from heat-related injury and illness from happening in the first place. So those are the prevention strategies that I talked about, like hydration, a policy, environmental monitoring. But not every single health and safety plan is fail-proof. So we absolutely need to be prepared if a heat related emergency happens that could result in a fatality. And so in the heat emergencies, exertional heat stroke is the medical emergency. It's life threatening, needs to be treated immediately. So here are the signs and symptoms of exertional heat stroke. And this is where I love to talk about this because there's a lot of misconceptions. And so the highlighted text here are what we refer to as the diagnostic criteria. So how we diagnose whether or not someone's having a exertional heat stroke. The person has to have extreme hyperthermia, but they also have to have what we call central nervous system dysfunction. That's altered consciousness, disorientation, confusion, looking out of it, and along with many other of these symptoms. You'll notice that the symptom or sign of no sweating is not there because that is a myth. If someone is suffering from an exertional heat stroke, especially in the workplace associated with physical work, they're going to be sweating because they're performing physical work. The reason why that no sweating myth even exists is because it's actually a different form of heat stroke. It's referred to as classical heat stroke. The classical heat stroke is what happens when it's non-physical exertion, so there's no physical exertion involved, and it happens in unfortunate situations like infants left in cars or elderly who are in their homes without air conditioning during a heat wave. So that's where that misconception comes from. So if you are trying to look for a signs and symptom, don't look for hot, dry skin. That is not an accurate for diagnostic or I should say sign for exertional heat stroke. And I want everyone to be aware, be careful with what type of infographics are being shared related to exertional heat stroke and heat exhaustion as well. This was coming from the CDC a long time ago and since has been revised, but it's still being circulated around. And so I've highlighted sort of with X's areas that are incorrect. And the reason why I point this out is because if you have the incorrect information about the signs and symptoms, you could essentially dismiss someone who's having an exertional heat stroke. And again, that is life-threatening. It needs to be treated immediately. And the reason why it's really important as well to treat someone quickly who has an exertional heat stroke is there is complications associated with delayed treatment. And we'll talk about in a second. A treatment is whole body cold water immersion. And so if someone collapses from exertional heat stroke and they are treated with best practices within 30 minutes, they're going to survive without complications. But if they go beyond that 30 minutes, that's when they get these long-term permanent complications or even death. So emergency procedures quickly for exertional heat stroke, whole body cold water immersion, like you see in the picture on the right, is the gold standard. A medical provider, typically it's EMS, will obtain a correct core temperature to diagnose that. And the goal overall, even if you don't have a cold water immersion tub, is to get the person's body temperature down within that 30-minute window. And so a lot of times people don't have medical providers on site. And so that's when you have to pay attention to those signs and symptoms. And if someone appears to be having the signs and symptoms associated with heat stroke, they need to be aggressively cooled, whole body cooling immediately. And so a lot of times people don't, and this is my last slide, but a lot of times people don't have access to a medical provider. And without being able to obtain a core temperature, they're not really sure how long they should keep someone in a cold water immersion tub. They're worried they're going to keep them in too long. So I wanted to make this study available but the recommended water immersion time based on data of exertional heat stroke patients. And so individuals emerge for 11 to 12 minutes when temperatures are below 9 degrees Celsius, so 48.2 degrees Fahrenheit, or 18 to 19 minutes when water is 10 to 26 degrees Celsius. So this at least gives everyone a ballpark because you need to treat the person immediately. You can't wait for EMS to arrive. Every second counts to be able to make sure that the person survives without complications. So I wanted to make sure I emphasize this, but actually, before I even end, there is one thing I like to share. Water rash shade is the absolute fundamental heat stress prevention strategies. I always tell people to start there. But if you have the resources available, I really encourage people to reshape um, OSHA's water rest shade by including other heat stress mitigation strategies like, rest is in there, education, shade and body cooling, hydration, acclimatization, plan procedures like emergency procedures, environmental monitoring as well. So you want to have all of these prevention strategies to utilize in your toolbox to ensure that your workers are safe, healthy, and productive. So reshape. Thank you so much. I enjoyed speaking with you all today, and I will be on for the Q&A.
Thanks so much, Maggie. Again, as a reminder, if you have questions based on Maggie's presentation, please move them over to the Q&A box so that our friends and colleagues that are participating on today's webinar can provide the thumbs up. We love our big words in public health. I'm wondering if you have any simple terms other than acclimatization for companies. Could it be maybe heat readiness? Or are there other words that people are thinking about? I can't imagine too many workplaces using acclimatization as the word that they're going to work on with their employees.
Yeah, I think absolutely. I think like the correct terminology is heat acclimatization, but I would utilize whatever sounds and works appropriately. However, it's going to help with the adoption and understanding of what it is.
Got it.
So I definitely leave that up to the workplaces, but I haven't found a good term yet. But if anyone has one, please share.
Maybe it's preparedness, heat preparedness. I'm thinking
Yeah.
about other disaster and emergency preparedness type responses. And so I like heat readiness. I like heat preparedness. With that, I'm going to introduce our other speakers for today. First is Inez Amenabar. Inez is the head of sustainability and strategy at Pantaleon Group, a sugarcane, ethanol, and energy production company in Latin America. Sustainability integrates environmental and social issues at Pantaleon, including worker health and safety. And Inez also participates in the Members Council of Bon Sucro, a leading sustainability certification, member of the World Sugar Research Organization, and board member of the Pantaleon Foundation. Inez completed her master's in public administration and development practice at Columbia University after completing a double degree in economics and politics at Lafayette College in Pennsylvania. So, Inez, thank you so much for joining us today. Please tell us a little bit more about the work you're doing at Pantaleon related to heat stress and mitigating this risk.
Karen, thank you so much for having me here. For us, it's always a great pleasure to be able to share how much we're learning, because I think that's the key message of this is that we're always continuously learning about how we can prevent heat stress, and we've been doing that with great partners like the University of Colorado. A little bit of Pantaleon. Pantaleon is a agro-industrial company dedicated to processing sugarcane. We have over 17,000 employees across 5 countries. And with that, specifically, our main production areas are in Guatemala, Nicaragua, and Mexico, areas that are, very risky to heat stress. So for us, heat stress is a real persistent risk that affects our workforce's health, productivity, and quality of life. And that's why for over more than 2 decades, we've been making heat stress prevention a cornerstone in our health and safety strategy. We have our overall sustainability strategy, and with our health focusing on people, we've identified what are the major risks for our employees, and heat stress is one of those primary risks. And this really came up because in the early 2000s, we became observing increases incidence of chronic kidney disease non-traditional origin. So these are younger workers, particularly agricultural workers or cane cutters, that unlike typical cases of kidney disease, they weren't caused by diabetes or hypertension, but we are working on a lot of those reasons we think that they're exposed to this, and a lot of that is linked to what we think is prolonged heat exposure and dehydration. So in 2004, we launched our formal water rest shade program in Nicaragua, which has grown a lot more, as Maggie has mentioned, to not just be water rest shade. But we started with that basic model and expanded that also to Guatemala in 2009 and to Mexico in 2011. The key pillars of our program are education, because we realize that it's not just water rest shade, but we do need to talk to our employees for them to understand the reason that we are implementing these programs. So we have staff in the fields with workers explaining the importance of hydration, renal care, and other health topics constantly. We implement a very strong hydration program where we guarantee access to potable water, at least 10 liters per day per person, and 3 to 5 liters of oral rehydration solution per worker per day. We have a very hard word to say, acclimatization and rest program. That means that even before we start, the cane sugar works through harvest. So usually starts November, ending in May. For all new workers or for all workers at the beginning of the season, there's a acclimatization process where workers are working very few hours a day, making sure that their bodies is adapting. And the same happens to workers who leave. So for example, during the holidays, we have workers that go back home to their families. So when they come back, they have to go through the same acclimatization process or a little modified version of it. And what we found is very important is rest. And this means, how do we make sure that workers are having shaded rest breaks structured throughout the work day? Making sure that they're all actually taking them. How do we communicate them? How do we reward them for taking those rests? And also at the beginning of each workday, we have warm-up exercises, which helps a lot with other forms of injuries, but also helping that body getting used to the heat during the day. We have primary care available in the field for workers. So we have on-site trained health monitors with first aid kits and a emergency preparedness program with ambulances in case there are accidents. These health monitors also make sure that workers are complying with the water rest shade program, making sure that they're drinking enough water, making sure that they're sitting in the shaded areas during those breaks, and just overall helping workers stay safe during the heat of the day. And of course, we have a whole system of monitoring and follow-up where pre-employment health screening, continuous monitoring, and real-time feedback loop to make sure that we are working this program correctly and that it is having a positive effect on workers. And obviously this we couldn't have done by ourselves. So what we started was very initial at first. And in 2016, we partnered with the Center for Health, Work, and Environment at the University of Colorado to support us with not only the identification and mitigation of health risks for the workers, but also to evaluate our existing programs based on scientific evidence. So we've been studying all of our interventions, making sure that there is scientific evidence to validate that they work, and how we modify them to make sure that they work better. For example, one of the biggest changes that we've done is the amount of oral rehydration solutions that we give workers. We realized that we needed to give them a lot more, because during the workday with hard work, they were losing a lot of electrolytes. This joint work that we've done has been really effective in making sure that our monitoring programs for heat stress are very robust. And here I'm excited to share that we are also have expanded not just to heat stress, but we're implementing this concept of total worker health that Colorado has helped us implement, meaning that we're covering all workers with all the major risks that we have, and that can include, muscles, alcohol and drugs, other programs that we are covering throughout our organizations. We are also continuing to do scientific research, collaborating. For example, right now we're working with two programs evaluating kidney disease and environmental factors in cane cutters, and also another study with women. Sorry. This alliance, we've done over 20 scientific journal publications. And in 2020, we've done the first article on the applicability of the concept of total worker health for agribusinesses in Latin America. So if you ever want to learn more on how to actually apply a lot of these concepts, we're here to open up our books and help you figure it out as well, if that's of use. And what we found is really we're seeing benefits, right? There's benefits to the reduce of incidence of kidney disease and of heat stress related illnesses amongst workers. We also find that reduces absenteeism and workplace incidents tied to heat stress. This also comes with something about people feeling safe at work and being very responsible on their own actions and how they implement their health. And of course, for us as a company, it's very fulfilling to us to see that we can ensure healthy working conditions if we implement these programs correctly. And this is something that we're constantly learning. We're constantly trying to figure out better ways to do it. For example, right now we're testing reducing work hours or moving, facilitating the movement of that rest shade. And all these things that we're constantly learning, trying to figure out what makes sense, and also making sure that it makes sense for the business as well. And I think that it's a challenge, but it's something that is very doable, because we realize that, mitigating heat stress is not just about the little programs. It's really about protecting the people who make our operations possible. And we're very committed to making sure this happens, and hope that we can share this, whatever we've learned, with others, and as well as making sure that we are all putting a bar on how do we invest in prevention, education, and well-being. So I thank so much for the opportunity to share a little bit of what we've been doing, and look forward to the questions.
Thank you so much, Inez. We have been so grateful at the University of Colorado to be able to partner with Ponte Leon and learn more about agribusiness and heat stress in outdoor and agricultural workers in Latin America. We see a lot of questions coming in on Q&A. Just as a reminder to our participants, if you have a similar or the same question as someone that's already typed one, you do not need to retype it. You can use the thumbs up feature to vote on questions, and we're going to have one more panel speaker before we get to our Q&A section and try and get through some of those questions. So it's my honor and privilege again to introduce another partner that's been part of the HealthLinks Network for a long time, which is Dan Siebert. Dan is in people operations at Eagle River Water and Sanitation District. He's worked at the Eagle River Water and Sanitation District for 17 years in a variety of different operational roles in the water and wastewater industry, and he credits his longevity and success to the organizational culture that has supported him, his growth, and his ideas in this work. So Dan, we've invited you here because Eagle River has done a lot of work to support individuals in working outdoors, and so tell us a little bit more about who Eagle River Water and Sanitation District is, and the controls and the supports you have in place for these workers.
Thanks, David. So Eagle River Water and Sanitation District is a water and wastewater provider in beautiful Vail, Colorado. We experience an influx of tourism throughout the year, whether it be for ski season or our beautiful summers. So I just wanted to take a few minutes to talk about some of the methods we have in place to reduce our risk associated with heat stress. So first, we look at it from our engineering and PPE controls. We can give employees shade structures, misting stations. One positive advancement we've made over the last couple of years is we started offering sun protective clothing that's UPF rated. That seems to be a hit with a lot of our workers in the field. We also offer UV blocking safety glasses that are Z87 rated for impact, but also UV blocking to keep the sun out. We found that wide brim hard hats are popular, or the additional sun shields that you can put on around the back to protect their neck. We also make sure that we stock sunscreen near all of our egress points to just simply encourage either the use at the site or refilling their personal sunscreen bottles. The next kind of caveat we look at is the education and training piece. Naturally, we're trying to do first aid training, or we cycle our employees biannually through first aid training, and we want them to be able to recognize the symptoms of heat stress and know how to act accordingly if they do appear. We also do wellness education on hydration, rest, sunscreen use. And along those lines, we also do annual skin assessments, skin screen assessments. This helps our employees identify and treat potential skin damage. And in the past, we've also brought in UV cameras that could take a picture and show existing sun damage that's hidden from the naked eye. And for someone that has freckles, that was very eye-opening to me to see that image. We also do annual biometric screens. This helps employees understand if they have any, if they're susceptible to heat-related injuries, as the previous speakers mentioned, cardiac issues, kidney issues, or maybe they have other health issues that could show up under heat distress. And then finally, we put a high priority on focus on our worker well-being. We try to encourage healthy behaviors through our education and wellness. So the importance of healthy nutrition. Our wellness team has put on, healthy potlucks where, you can try out other dishes. We preach the importance of hydration and sleep. So every March we do an annual fitness challenge. We coined it the March into Fitness challenge. And this year we added hydration and sleep as categories for employees to kind of compete against, because we know that these are important to protecting them and dealing with heat stress. And then education on how lifestyle choices can affect our heat tolerance, your alcohol consumption, our diet, potential medications you're taking. And then the last piece of the pie for us is the mental health aspect. We have a employee assistance program. We're very open about it. We communicate it often, and we want employees to handle their stress, their fatigue, whatever is their ailment, because this also makes workers more vulnerable to heat illness. And then we try to sustain a positive workplace culture where concerns are heard and breaks are encouraged. We want employees to take their breaks, rest, and cool themselves off if needed. We found that this is a pretty comprehensive way for us to deal with it. And if you've got any more questions or would like any resources that I might have spoken on, feel free to ask questions now or hit me up after the presentation. Thanks, David.
Thanks so much, Dan. We really have appreciated partnering with Eagle River Water and Sanitation District. The annual skin screening test that you all do is something we've shared with a lot of employers in our network. It seems like a no-brainer, and yet it's a unique feature that you offer to your outdoor workers that not a lot of companies do. So thanks for being here. I'm going to ask Dr. Morrissey Basler, Inez, and Dan to rejoin us here for the question and answer session. And I'm honored to introduce my colleague, Dr. Miranda Daly, who's going to help us with the Q&A and the moderated discussion. Miranda is a research assistant professor at our School of Public Health at our Centers for Health, Work, and Environment. She has seen firsthand the effect of climate change has on workers in their communities. She is the co-founder of the Climate, Work, and Health Initiative and dedicated to keeping workers and their families safe, healthy, and productive by preventing and reducing health impacts from changing climate. Dr. Daly's research examines the ways that changing occupational hazards due to climate change affect agricultural worker health and well-being, specifically how increases in occupational heat exposure lead to injury, illness, and impact the ability to work. Miranda takes this research into practice by working closely with employees and their employers on ways to protect and sustain the health of workers who are responsible for global food supply. So Miranda, thanks for joining us today to help moderate the Q&A discussion. I'll turn it over to you from here.
Yeah, thanks, David, and thanks to all of our panelists. Full disclosure, I work closely with Inez and her team in Guatemala, so I have some firsthand knowledge, so that might color some of our questions. But the first question that we have in the chat, Inez and Dan, I'm hoping that you can answer. There's some question about whose responsibility within the workplace it is to implement these best practices that Maggie had mentioned. And so can you talk, is it the CEO? Do you have a health and safety person who's completely responsible for heat? So for both of you, maybe we'll start with Inez and then Dan. Can you let us know who is responsible for the heat safety program at your company?
Sure. So for us, we have dedicated occupational health individuals at each operation who report to the overall health and safety, occupational health and safety, SSO. But really, I think the key topic here is that it wouldn't have the robustness it has if it wasn't because top leadership is involved in this topic. So I would say, even though it's their responsibility and they're the ones who need to make sure that they're implementing the project correctly, there needs to be oversight from top leadership to make sure that the program keeps running smoothly year by year, and that there is this constant improvement, modifications, making sure that we're keeping on track with what we say that we are doing.
And Dan, what about you?
I'm going to mirror what Ina said. Definitely, we have a dedicated safety representative. It's also the top-down approach. And then I think the last piece is we also kind of built this up with our safety committee. So employees on the ground, asking them for feedback, what works, what doesn't work. And the employees that participate in the development of that, we use that as an opportunity to highlight that on their employee reviews, or things like that, that, hey, this person's going above and beyond their daily duties to help us really drive the program.
Great. All right, Maggie, this next one's going to be for you. There's a question as to whether or not companies should develop policies to define conditions that would just be too unsafe for anyone to work. So is there any kind of guidance on whether people should be allowed to work or not more than X hours at a time if temperature is above X degrees?
Yeah, so that's a great question. There's a variety of different recommendations related to it's mostly using environmental monitoring like wet bulb globe temperature or heat index or air temperature, ambient temperature to define those thresholds, as well as having estimations of like how hard do the workers typically work, and we refer to that as metabolic rate, and if they're wearing any other clothing. So there's no universal threshold at this time, especially because, and I actually would never recommend that because of the incredible differences that environmental heat load have depending on the different geographical locations throughout the US alone in the world. But as a starting point, my recommendation would be to look at guidelines from NIOSH or ACGIH as a starting point, to be able to first determine what's been done or advocated for in a research perspective, but then be able to modify depending on your certain work environment. I wish there was a straightforward answer, but we still have a lot to do in the research world to be able to develop these clear guidelines.
Great. Thanks, Maggie. Inez, I think one of the best practices that I have heard might not be one of the most practical practices, or that is really hard for companies to implement, is this idea of acclimatization. And so you've mentioned that Pantaleon has implemented an acclimatization program. And I was wondering if you could just explain a little bit about the decision to do that. What was the driver? Had Pantaleon identified that as a need, or where did that come from? Because I know that that's something that a lot of companies struggle to implement.
Sure. And I think it's actually came from some of those recommendations of what we could do better. And to give you an understanding how our business works, it's that we are only operating from November to May. So a lot of these people aren't, we don't know what they were doing before, but they could have been doing, you know, other crops or other jobs, but probably weren't exposed to heat as much as they will be as they start the harvest with us. There's also a large proportion of our workers are coming from the Guatemalan highlands, for example, in Guatemala. So they're moving from different climates down to the southern coast of the country, where it's a lot hotter and a lot more humid. So we found out that if we were able to start introducing less hour, you know, a fewer hours with bigger breaks during the first weeks of the Safra, that was going to help workers deal better with the change in environment and the change in, you know, the work requirements, the physical work requirements. And also that was reducing a lot of these initial damages of heat impact that we could have from, you know, going from probably someone working in their own home in cooler temperatures to working in the field. So I think that understanding also where these workers are coming from helps make that decision even better.
Great, thank you. And to follow up, Maggie, we had a question about the ideal reacclimatization timeframe. And so what is the recommendation for when you would need to reacclimatize a worker? How long would they have needed to be out of the workforce for?
Yeah, so typically you lose the adaptations that you achieve through acclimatization after 2 weeks. Well, ultimately, you actually lose some adaptations even just days later. But from a practicality perspective, 2 weeks is sort of the threshold of there needs to be a reacclimatization purpose, and that the good thing about reacclimatization is you're not starting from square one. You're not having them do the complete gradual exposure. They already have those adaptations that are going to come back much more quickly. You just typically can be from 3 to 5 days, whatever is optimal for the company.
Great. Thanks, Maggie. Dan, I'm going to pose this one to you, but before I do, I want to ask, do you have any workers do your workers go out and are working offsite by themselves, or do you only have workers that are kind of working in groups together?
We have some workers that are out by themselves, yes.
Perfect. Then this question will be great for you. So there's a question about additional training for lone workers. So how do you guys handle the risk of heat stress among workers who might be in the field by themselves? Is there any additional training you provide them? Any additional technologies that they have access to keep themselves safe?
Yeah, so we divert to technology in that aspect. So we first aid, we want everybody first aid, CPR certified. That's part of their performance review to make sure that that's not lapsing out for a while. So we want them to be able to recognize it. And then currently we're using Garmin InReach devices, and we've got them set up, pre-populated with contacts so they can either reach out to their supervisors or they could call for help in a situation where they were by themselves. And then, but ultimately we try to avoid people by themselves, but our system spans almost the entire county. And I'm sure like a lot of the panelists and listeners, it's not always possible to put people together. And so that's how we deal with it.
Great, thank you. I think one of the questions when we're speaking about technology, there seems to be some awareness of the OSHA NIOSH heat safety tool. For those of you who aren't familiar, that is a phone-based app that tells you what the heat index is, which is a combination of ambient temperature and humidity and risk levels for workers. And so, Maggie, what is your opinion on those types of tools for field staff to be using?
Yeah, that's a great question, and I get this question a lot. And I try to come at it with a perspective of I understand, some things related to environmental monitoring can be really tricky. I always try to advocate where possible to measure the actual temperature conditions on the work site, because the actual conditions you're in are going to differ from what's captured from local weather stations. Like, for example, if you're on asphalt or you are on working near metal, it's going to be very different. So always advocate for that. It's considered the best practice. But with that, I fully recognize that it's not always possible. So something is better than nothing. And these tools can help sort of determine when there needs to be some sort of intervention, if, heat index or wet bulb globe temperature, whatever is being estimated, is at a certain threshold. So yes, I like it, but it's not my favorite.
Thanks, Maggie. And building off of that, as you mentioned, there's people with certain health conditions that may or may not be at a higher risk. And so, Inez, what is Pantaleon doing, and what is kind of your perspective on companies being aware of the health conditions of their workers and the physical work environments that you're putting them in?
Sure. So we are strong believers of pre-screening for medical health conditions, because we want to make sure that the job doesn't make existing conditions worse. So it's this concept of fit for work. We make sure that in that pre-screening, we identify key factors that could be my English, sorry, I just forgot the word, but that could get worse if they can continue to work, and we're making sure that people are working in the jobs that are good for them. So if in that pre-screening, for example, there are certain health conditions that can get worse with certain jobs, we'll place them in jobs that don't have that exposure. So making sure that fit for work, I think, is something that we've learned specifically from Colorado, and I think it's very beneficial for workers, making sure that they are in the right jobs for their health.
Great, thank you. I see that David came back on screen. I'm wondering, are we doing okay on time, or are we
Thanks,
getting
Miranda.
the
We
hook?
probably have time for one more question.
Okay, I think the last question, Maggie, I'm gonna have for you, and it's a question about how you get big agencies like the Department of Transportation to make sure they're up to date on these key tips. So what are your strategies to ensuring that these big companies are getting this advice?
Yeah, so I think sort of having this continuous momentum with state legislation is huge. I think when people, and I apologize to those who are outside the US, this is specific to the US that I'm talking to, but can apply, globally. But I think having legislation pushing people forward to recognizing that this is an issue, and then having them identify what are some of these best practices. And with that, we need to dedicate more funding to research to be able to determine what are these evidence-based practices, what's best in certain industries. So I think a sort of a combination of those two things.
Great, thank you. And then Maggie, Dan, and Inez, I'd like to just flag for you, there are a couple of open questions in the chat box that I think I don't want to put you on the spot for. So if you want to just take a quick look at those and answer them before we log off, that would be great. Okay, David, go ahead.
Thanks, Miranda. Inez, Dan, Maggie, you can find those in the Q&A section. There are a few specific questions. The note too, for everybody participating, we will share today's slides and presentation that include things like the infographic that Dr. Morrissey Basler had, and other information from our speakers. So our team is putting the link to the survey up in the chat, but hopefully that will also come as soon as you sort of leave today's webinar. First and foremost, I just want to really thank Dr. Morrissey Basler, Inez, and Dan, and Dr. Daly for hosting this really informative and important conversation. on this specific occupational stress and exposure on heat stress. This is really a great discussion on translating science into practice and having a really important occupational health conversation as things are heating up in Colorado and heating up around the world. So I'm hoping that all of our participants got some good takeaways from today's webinar. Our next conversation that you'll be invited to when you complete the survey today is on the state of workplace mental health. So this will be our 6th year in a row where we've had a conversation about workplace mental health in the month of May. As many of you know, May in the United States is Mental Health Awareness Month, and I'm really I feel grateful that we've been able to have this conversation on the state of workplace mental health for six consecutive years. And we have a really impressive lineup of speakers coming up for the conversation on workplace mental health, which is always important in any year and is even more important in a year like 2025, where there's so many challenges and stresses coming at us from a lot of different domains. So we hope you can join us on May 21st for this conversation. And then also, as you log off today, please make sure to fill out that continuing education, the feedback survey. We really appreciate the comments that you have for us. And then if you have any questions about HealthLinks and our program, please also feel free to reach out at our general contact inbox or to me directly. So you'll get the follow-up email with the recording of today's presentation and resources soon. Thanks again, everyone, for joining us today. Thanks to our speakers. We appreciate this dialogue.